好，各位观众今天我们比预定时间稍早了1分钟、2分钟，因为视频刚刚出现，我发觉他们换了地方了。现在是背景是飞沙卫生局，后面是飞沙卫生局的口号更加健康，更加健康护理。这个是飞沙卫生局下面的一个口号吧，可能不是我们 BC 省的。那么今天呢是10月29号。星期四，按照惯例，每周一和每周四，所以是本周第2期的新闻直播。从上个礼拜五，确切的说，从上个礼拜五开始到现在，几乎每天新增的病例都是200，新增阳性确诊案例都是200以上。这个是今天看看是多少。自我安慰一下只能说是自我安慰一下，这个住院的情况还可以。礼拜一呢是说汇报是77个，今天那个卫生厅厅长也来了他政治活动结束了全部戴口罩了，大家看到了吗？全部戴口罩了这个大家可以看看，全部戴口罩了。好，现在口罩又拿下来了，这是一个姿态，也就是作秀，这个也具有现实意义的。今天多了一个主持人出现。
Good afternoon, everyone, and thank you for joining us today for the provincial COVID-19 update and media availability here in Surrey. I'm Dr. Victoria Lee. I'm the President and CEO of Fraser Health. I'd like to first start by recognizing that we are conducting our business today on the unceded and traditional shared territories of the Katzie, Semiahmoo, Kwantlen, Coquitlam, and Tsawwassen First Nations. I'm so pleased and honored to join Minister Dix and Dr. Henry for today's COVID-19 update. British Columbians have been applauded not only nationally but also internationally for our COVID-19 preparedness, response and recovery. Leadership from Minister Dix and Dr. Bonnie Henry has been integral to our pandemic response. Wave 1 has taught us that when we are united in our efforts, we can bend the curve. We need to work together again and stay strong to safeguard our loved ones, our communities, and our health system. Fraser Health is BC's most populous health authority and serving 1.8 million people from Boston Bar to Burnaby. While Fraser Health represents a significant percentage of the total BC cases, we also know that COVID-19 knows no boundaries. That is why it is so important that everyone in every part of our province does their part. From what we are seeing, even small gatherings can be risky right now. At this crucial time, we're asking people who reside in the Fraser Health region to take a pause and reconsider our social interactions outside of our households. This is in addition to the public health order Dr. Henry shared earlier this week. Ensure your safe six are always the same safe.as much as possible, please socialize with people outside of your home, such as public outdoor spaces like parks or licensed COVID-19 safe businesses. If you need to bring someone home, please ensure that they are part of your safe six, the same six, and that you're able to visit in a COVID-safe way. Fraser Health family is made up of 30,000 staff, medical staff, and volunteers. Heroic efforts are made on an hourly, daily basis to protect the public. Some of the examples include effective case and contact tracing, which we've had 26,000 people to date, an expansion of testing and surgical services, and rapid deployment of patient-centered virtual care services. I'd like to take the opportunity to thank all of the Fraser Health family And I'd also like to thank Minister Dix, Dr. Henry again for your support and for joining us this afternoon in Surrey. We have bent the curve before and we can do it again. And now I'd like to invite Dr. Bonnie Henry to share today's provincial update.
Bonnie Henry 和卫生厅长给我们做卫生简报。好。最关键的数字来了。
Thank you very much.
谢谢大家。
And I appreciate very much being here
非常感谢我能够过来。
We are honored to be holding this briefing in the Fraser Health Region.
很荣幸在这个卫生局下做这个卫生简报。
Of reaching out and showing support to those in our community in a safe way.
也是给大家一个支持。我们现在在这儿来，也是因为这个现在最近这个很大的高峰这个特别是飞沙卫生局下面的低谷平原。 特别是不正常的这个高，不按比例的，他的意思。
Whether it's in healthcare, in long-term care,
那么特别是这些这个学校啊、长期护理院呐，以及这个护理院等等啊。
carrying us through the last few months.
所以在接下来的过去的几个月里边，都在积极的努力抗疫。
Who are working so hard
大家都很工作努力，在希望把这个疫情的冲击降到最低程度。
So for today,
那么今天的数字来了。
we are reporting 234 new cases of COVID-19 in the province, including 4 which are epidemiologically linked, bringing our total number of people with COVID-19 to 14,109. That includes 4,588 people in the Vancouver Coastal Health Region, 8,036 people in the Fraser Health Region, 256 people in Vancouver Island Health Region, 734 people in the Interior Health Region, and 406 people in the Northern Health Region. In addition, 89 people from outside of Canada. We now have 2,344 active cases, of whom 86 people are in hospital, 24 of whom are in critical care or ICU. Sadly, we have one additional death to report today in the Fraser Health Region. And the tragedy of this death is one that I want to share with you because it is something that reminds us of how important the measures that we need to take right now can be in protecting lives. This is a person in their 80s who attended a small birthday party, and by small, less than 10 people were at this home, and unfortunately, somebody unknowingly got COVID-19, and even though it was a small party in one person's home, the majority of people who were in that home became infected with COVID-19, and this person unfortunately ended up in hospital and dying from it. And I know her family and the care teams and the community mourn her as we do as well. It reminds us that this virus can't tell the difference. And even in a small gathering, when this virus is circulating, can be dangerous. We now have 5,714 people who are under active public health monitoring, and 11,448 people who have recovered from COVID-19. Additionally, we have 4 new healthcare outbreaks to report. The Gateway Assisted Living for Seniors, the Mayfair Terrace Retirement Residence, Lakeview Care Center, and Louis Brayer Home and Hospital. And in 3 of the 4 cases, it's been a single healthcare worker that was identified early. And I think that is, again, a reflection of the important work that we're doing in public health and here in Fraser Health to make sure that we protect people in these high-risk environments. One outbreak, in addition, has been declared over at the Zion Park Manor, leaving us with 25 active outbreaks in healthcare, 24 in long-term care assisted living, and 1 in acute care, affecting over 1,002 people, 567 residents, and 435 staff. We have no new community outbreaks to report today, but a reminder that this virus continues to circulate and that we continue to see cases associated with businesses, with gyms, with other settings across the province.
括其他的学校啊等等等等，都是要格
So
外
for
小
many
心。
of us, we know that fall is a time when
那
many
么他说
holidays
大
and
家都知道
celebrations
这个
occur.
秋天
We've
来了，
had
接下来有
Thanksgiving
很多的
already,
节
and that
日
tragically
要
has
大
led
家
to
要
an increase in
包
the
括
numbers of
这次
cases
感
of
恩节，大家看
COVID-19
到了
that
很
we're
不幸
seeing.
导致了这么多的
We
新
also
增案
know
例。
that Halloween is
我
coming
们
this
现在也
weekend.
知道
We
这
have
个
Diwali,
周末
we
又
have
是万
Remembrance
圣
Day
节
and other
那么
celebrations in
印
the
度还有
coming
一个
weeks.
德
It
瓦
is
里
a time
节
as well
这个
of
是
cooler weather
那么
and
现在呢，同
increase
时呢
in
天气又
in
冷
coughs
了
and cold
那么
season.
又可
As
是
well, more
开始
people
流
are
感季
spending
节来了
time
或者是感
indoors.
冒季节来了
And we face the
那
added
么大家又
challenge
有咳嗽又
of
容易
having
感
a
冒
pandemic of
大家
COVID-19
呢
in
有
our
很多活动
community
又转到室内
now.
来那么这样的
Many
话
of the
呢
new
又现
cases
在
we
又
have
是这个
today
全球流
are
行季节期
directly
间
linked together
所以现在很
in
多
our
的新
homes
增案
and
例都是
elsewhere
连起
that
起
are
来
now
的
resulting in community
那
transmission
么
of
现在就是导
COVID-19
致了社区里
across
边的
the
传播
province.
整个省
But this
都
has
是这
been
样
particularly the case in the
所
lower
以
mainland
那么
and the
特
Fraser
别
Health
是我
region.
们第一路
This
平原
Halloween
特别是
weekend,
飞
we
沙卫
need
生
to
局下
celebrate
尤其
in
明
new
显
ways.
那么希
We
望大
need
家
to
今年
keep
用一
our
个不同的
groups
方式
small,
来度过这个万圣节
particularly
希望大家
our
人员聚
own
集少一
households
点
in our homes
那么特
and
别是
small
在我
if
们
we're going
家
out
里
in the
边要
streets.
举办
We've
这个
talked
万圣节
before
的
that
话
we can
我们都
celebrate
去
in
说
safe
过
ways
了我
with
们
our
有很
household
多
and
的
our
方法
families.
能够安全的
If we
去
are
度
doing
过
trick
这
or
个节
treating,
日
it needs to be
那么
small,
特别是
and
那个
it
孩
can
子
be
们
done
上学
safely
上门
outside
讨
with
堂
small
也是
groups,
有一些
making sure
创
that
新
we
的
give
办
the
法
others the
能够
space to
让孩子们
stay
也
safe,
安全你也安
and
全
also
保持距离
importantly
保
to
持空
respect
间
those homes that are
那么
choosing
也
not
是
to
相互尊重
participate
相
this
互
year.
尊敬
We remind everyone
所以
that a
这个是给
province-wide order
每一
is
个人
now
都
in
是一个
place,
提醒
limiting the
我
number
们
of
现在
people
这时
who
候
can
就是
visit
要
in our
从现在
homes.
开始做
That
每一个
means
人都
no
是做
Halloween parties this
没有
weekend.
什么人员限
This
制
is
或者什
because
么就
many
不要
of the
做能
things
不
we
做就
do
不
at
要做了
parties and
今天有一
celebrations,
位
things like
死亡的
talking
一个
and
80 岁
hugging
老
and
人
eating
就是
and
10个人
drinking
的生
together
日
indoors
生日那个庆
are
祝会
much
那么希望
riskier,
大家避免就不
particularly
要
now.
什么拥抱啦
And
不要
often
kiss
they're
啦
with people that we
特
care
别是
about
室
and people
内
we have
千万
not
不要
seen
再
in
这
a
么
long
做
time.
了
And it's very
我们
challenging
长
for
时
us
间干下
to
来室内的
resist
传
that
播是
need
最
to
大
hold
的
people close.
大家很容
Just as we
易
want to keep our groups
避
to no more
免
than
近
6
距
when
离
we
的
go
交
to
流接
restaurants,
触没办
so
法
we need to keep
所以我们
our
现在
groups
记住
small
10个
at
记住
home.
不要超过6个
If
人
you
到
are
包括
thinking
餐
about
厅
seeing
你
people
们
from
每
your
个桌也
safe
不要超过6
make
个
sure
人
it is the
在家里
same
边也
group
是
of 6.
我们希
And
望
rather
这我
than
们
getting
safe
together in
6
someone's
英文里边叫
home,
safe
choose to
6
go
大
to
家
a
听懂
location
就
that
是
has a
safe 就是安全
comprehensive
6
COVID-19 safety plans and
安全6
precautions in place.
所以我
And where
们
we have seen people following those
那么我们已经
safety
看到
plans
很
in
多人
restaurants
跟遵照
and
我
in
们
other
的这个
settings,
行为规
we
范包
know
括
that it
餐
works.
厅
It does
等
prevent
等等等
transmission
我
of
们已
this
经看到了
virus.
这个病毒没
There
有
are some
传
very
播
clear reasons for
没有
this.
这个
First, for
变
most of
坏
us, our
所以这
homes
个
do
很
not
清
have
楚
the
了我
space
们
for
的信息很
everybody
清
to
楚
keep that safe
我们
distance that we
第一
need
就
right
是
now.
要保持安全
Second,
距离
our homes don't have those layers of protection that we have
那么
built
我们
in
在家
to
里
other
边
places
那么又没
to
有
slow
足
the
够
spread
的
of
这个卫生的
COVID-19.
防
We
疫
don't
的
use such
措
things as
施
plexiglass barriers
所以
and
这个呢
one-way
我们希望
pathways
大家还是
in
要
our
遵守
homes,
这
which
个
naturally means that we will be closer to
安
each
全
other.
6个那么因为
And
你家里
often
边又
in
没
our
有有机
homes,
玻
we
璃
are
去割
more
很多
familiar
事情
in our
所
familiar
以希望
settings.
大家还是
We
能
may
够
follow all of the precautions when
特
we
别是
go
我
out
们
to
的
a
家
grocery
庭聚
store
会
or when
等
we're at
等
school.
希望大家
But
还是
because
要
we're at home, our
能够
awareness of
安全
following
措施
precautions
包括
is
孩子
lower.
们的学校
And finally,
也
while
希
we
望
may
大家
have
能
the
够遵
best
守
of
我们的防
intentions
疫
to
措施
maintain our
能
distance
够
and
减缓
use
降
those
低
layers
这
of
个风险
protection to support
能
those
够大家
around
能
us
够尽量保持
when
距
we get
离就是
together,
保持 持距离。那么我们其实大家已经有一段时间大家分离了，那么就分离了，这个已经分离了，已经分离了。那么对大家来讲，可能有一种抵抗不了的诱惑啊，看到亲爱的人啊，那么大家可能握手啊、拥抱啊，希望今年不要这么做，好吧？大家就是能够相互之间有一个距离保持。就算我们自己觉得没有症状，我们很好啊，也有可能你的身上有带病毒要传播给人家，所以特别是在室内的密闭的环境下，特别是当你们在分享食物的时候，特别是在这种环境下，所以希望大家能够那么这个因为这个传播还是特别近距离的传播是特别容易我们已经看到了很多很多的案例了，所以我们希望大家那么现在全省有几千个人在隔离了所以 他说现在已经超过了5000个人了，已经在自我隔离了他们不去学校，他们不去 daycare， 他们不去上班所以而且他们的生活需要人家来照顾他们这个都是你们自己的选择，所以大家怎么样的行为导致什么样的后果那么我们的很多的这个文化传统、文化习俗，希望今年要改变我们需要更多的时间去考虑这个安全我们不要去在这个家里边再去做一些社交的举办的些社交活动那么我们这样子才能把这个疫情曲线拉平所以我们每个人都要做自己的分内的事情，做好自己的事情那么不要再把家里边办很多的大型活动了不要再去做这些活动了不要再能不去了就不要，比如说到这什么俱乐部或者是健身房等等能不去不去了我也知道大家觉得很不方便我也知道，我们也看到了很多人，我们省里边很多人都做了正确的事情我也感谢大家，你们这样做的话才能够病毒能够减缓传播。我也鼓励大家继续做下去希望大家再注意这个什么事情是最重要的，希望大家能够就又联系起来，但是呢物理距离又保持所以我们希望大家现在就做安全第一，所以我们现在一定要考虑到我们现在这个环境那么我们也知道这个要多一层保护多一层措施这个是我们的所有包括这个口罩是我们最后的一个手段我也感谢大家，希望大家现在就做，立刻行动起来但是大家还是要又是 remain calm 保持安心然后呢对大家他说 be kind to each other 相互之间客气容让，同时呢他说 be safe 就是这3个。那么卫生厅长作为一个政治人物我这方面是已经看不起了他是要去做审选他就不来了那么今天的审选结束了，他们这个新民党是夺定大多数，所以他又回来了那么他作为官员好像做一个其实我们已经习惯了，他不来了那么他也说到了这个新增的1例死亡的这个情况我们知道你们的痛苦，你们巨大的损失巴拉巴拉巴拉
I think part of the challenge in these times, part of the things that we've had to learn to do that we would never have wanted to do, is to learn how to grieve together, to not, as much as we want to, be close to people when really they need us, to visit their homes. And the changing in the way that we celebrate life has been one of the hardest things, but it is, especially here, a necessary thing when we're dealing with these circumstances. But in this case, as in the case of all those who passed away, the 262 people who passed away from COVID-19 since the beginning of this pandemic, who've lost loved ones.
已经到现在已经死了262个人了累计。
In British Columbia today, there are 86 people in hospital from COVID-19.
今天是86个人，其中24个是住院，46个是在我们飞沙下，基本上都是在飞沙和沿岸。
And the case counts today remind us that while there's a focus of cases in the face,
那么他说每天新增的案例始终告诉我们这个病毒在，提醒我们病毒在希望我们大家每个人注意继续那么每个卫生局都面临不同的困难每个卫生局工作的重点防范都不一样，每个人的程度也不一样，每个卫生局那么有些卫生局下面的新增案例不多，那么有些卫生局下面的卫生那么他说北部卫生局现在又开始有一点冒出来了。我们今天现在在树里，我也没有提醒大家，也感谢大家那么谢谢大家他们这个 Dr. 李医生，就刚才那个 Victoria 他领的一个团队，那么在个卫生局下有数千人在做这个检测工作在做 这个接触追踪他们的格外的辛苦努力他们因为这个调查工作真的是苦辛苦就是刚才那个 Victoria Lee 他带领的那么每天呢现在是有超过了1万个完成这个新冠测试所以我心存感激每一个人所做的努力特别是费沙卫生局大家正在应对这个新冠病毒我们也很能理解你们面临的困难每个人彼此每个人的困难我们希望大家每一个人都能够行动起来遵照我们的卫生指令包尊重这个亨利医生的卫生命令那么现在我们也在积极的招聘人员在做这个就是跟踪接触工作那么上个礼拜又新增了63个人在做这个新增的63个人做这个跟踪调查接触等等那么2个月前大家记得吗我们新增了500个新招了500个那么这是8月份的宣布的那么有一个 pipeline 就是一个时间轴那么现在就是这个500多个人是怎么分布300多个是怎么样700多个那么现在呢我们还要准备招800个协助这个公卫系统的工作人员去做跟踪接触调查工作
And that demonstrates, I think, the desire of thousands, tens of thousands, hundreds of thousands of people in D.C. to be part of it, to help their friends, to help their neighbors to be involved.
看来他们你们发觉吗这个跟疫情当初他们的工作完全不一样了刚才疫情当初的时候他们就跟大家汇报如何准备医疗资源包括这个病床怎么准备怎么空出来择期开刀手术怎么减缓怎么取消现在就是告诉大家我们怎么招聘多少人招聘增加多少人来这个跟踪接触工作这个所以这个也看出来就是这个病的这个感染人数越来越多但是住院人数特别是 ICU 人数没有按比例增长
by nurses, by health sciences professionals, by surgeons, by HEU administrative staff, everyone, to ensure, and by cleaners, to make sure that we are doing an unprecedented number of surgeries in our public healthcare system in the time of pandemic. Just to put this in context, for 4 consecutive weeks between September 14th until October the 11th, we're performing more than 7,000 surgeries a week, which is exceptional. In the week as reported last week from October 12th,
真的是不容易都是说的是开刀的情况那么从10月12号到18号单单一个周就完成了5920例因为这里边又包括了一天的感恩节
in the report the following week when we get the final numbers. This is exceptional, certainly above what has been done in previous years.
这个已经就算这个新冠病毒疫情下我们所完成的开刀数每周完成开刀数都是比之前历史上高这个是感谢大家的共同努力
through to the middle of May. And again, that success, those actions, that activity is made possible by what everyone does out there. By following the public health orders and directions of Dr.
所有的这些成绩都是大家遵照了我们的卫生官所指示的这个卫生命令下安全的去做这些事情所以也是大家格外的辛苦格外的努力那么我们还会继续的这么去做这个也是我们的承诺我对我们社区的承诺我们还是继续下去
Until a cure was found, a vaccine was in place, until the threat was effectively ended, we would learn and we would adapt.
那么也是说到了应对这个新冠疫情所带来的冲击包括新冠病毒对我们社会的威胁我们都在学我们也学了很多我们还要学很多我们也学取很多经验教训我们不断的总结不断的总结那么我们也不断的在这个累积我们的经验
As we fight COVID-19 and continue to rebuild our province, our community, and all
那
that
么他
holds
说，
us
通过这
together.
个新冠疫情呢，也使得我们重建我们的这个家园，重建我们的社区我们也是使得我们更加团结这个说得很好 ，holds us together 就是使得我们在一起就是团结在一起。
Every single community, every one of us.
这个他的官员说法和这个 Bonnie 的说法真的是不一样。他是Bonnie Harris 是首席医官，他更多的没有政治，首席医官是更多的是公共卫生方面的指令，所以他说的话和我们这个卫生厅长说的话还是不一样啊。
No community is immune to COVID-19.
那么他也是说到了，没有人没有社区是天生免疫对这个新冠病毒的。 特别是那些偏远农村地区这个是很重要的，因为他们又离开这个医疗资源远嘛，所以这个也是特别注意。那么，所以希望大家也是相互支持每个社区都会从这个相互资源当中受益那我们却看到了德国法国等等都是在这个。第二波很紧张的第二波所以我们现在也是代表我们自己，代表我们的朋友，代表我们所爱的人在做应该做的事情。那么现在卫生厅长又说法语了，那么我又有时间给大家汇报这个数字。昨天到今天24小时新增了234例，那么BEC省现在累计是14109例，其中延安卫生局是4588例，飞沙卫生局是8036例，岛上卫生局是256例，内陆卫生局是734例，北部卫生局是406例，那么境外获得增加了1例，变成89例。到目前为止，现在今天2344个案例还是在活跃的，记录在案的，其中住院的是86个，重症监护是24个，那么星期一住院是77个。重症监护是26个，现在看来重症监护反而是下降2个。现在都是做了一个姿态戴口罩也不戴口罩，反正这个姿态是告诉大家了。这个就是我们都戴口罩了，就是这个给大家看。那么这位记者问：你们今天把这个简报会放到树里卫生局下，有没有特殊意义？是不是？但是我现在没有数据，但我们在 BCCDC 上都有，官网上都有。每一天我们都很注意这个阳性案例因为这个这个阳性案例主要是实验室完成的数据反映出来的那么如果这个测试的越高，那么数字的阳性会越多所以我们现在都在监视当中那么现在是每7天7天一个周期，7天一个周期多一个平均数所以每天下午我们的 BCCDC 网站上都有都会有分类就是具体到每个市但是这个是都会反映了一些这个每个地区的这个疫情情况那么这个呢也是说学校里边的各种活动，但是这个我们也是有更多的应对的方法，应对的措施我们也是监测学校里边的情况那么因为我们是每一例都要了解他们是不是相互之间联系起来我们都会做记录，有些是急行性的每1000例每100例每10万人里边有多少些急性病我们都会做一个这个大数据的分析使得我们对疫情有个准确的了解我们现在每天都要看学校的数字我们是有爆发的不是爆发暴露的情况 exposure 但是我们在没 的确没有看到学校里很多的传染情况，到目前为止只有一个学校是 outbreak 爆发情况在这个内陆卫生局下，所以我们现在还是要考虑到没有考虑到这个关闭学校我们现在还是要重点是关注这个重点注意社区里边如何确保学校安全的开放这个是我们所要采取的行动我们不是说为了关闭学校去做这个事情
important functions in our community that keep our community well.
所以他说使得我们社区安全这个才是我们重要的。
Richard, do you have a follow-up?
I was just wondering about burnout. I know you mentioned we're now increasing the number of contact tracers that are being hired, no doubt to meet demand. One of the things we're also hearing.
那么这位记者问的就是雇佣这个更多的人来做跟踪接触调查工作他说这个毫无疑问对这个增加这个方面的跟踪接触工作会有人手多了，工作会更加好。
You know, I think we are worried about all essential workers and the challenges
那么他说了你们这么跟踪接触工作多了之后那么人越来越多那么他们之间的工作不是风险越大了吗他说我们对所有的基础工作人员的安全都考虑包括学校的老师包括其他行业的包括这个长期护理院的员工那么教师们和我们一样的没有区别的他们也是需要重点关注我们也是需要给他们资源就像我们也给长期护理院的员工资源一样支持就是你在比如说你在这个长期护理院的他们会有很多的这个很多的焦虑就是在这个长期护理院的病毒在长期护理院边的流传因为这些基础工作人员使得我们的社区在正常运转所以这些都是我们都要给他们支持他们都是同样的重要我们要保证他们的安全所以我们现在呢也重点的要请大家呼吁大家注意这个社交在这个社交方面呢要增加卫生措施减缓这个病毒的传播
Oh, hi. Dr. Lee said that people in Fraser Health should reconsider having people over. What does that mean? Are you ordering people in Fraser Health not to have their stage 6 over, or is it just a recommendation? And if it's not an order, why not make it an order? Lots of other provinces have different regional restrictions based on where the high COVID numbers are.
Yeah, so we have an approach here in British Columbia that we've taken together. There is the possibility of adding regional specific orders, but
那么他说全省制卫生命令是一样，各个卫生局下还有自己的特殊的一些命令，卫生命令大家都有一些这个行为的指南因为每个卫生局下面的这个情况还不一样所以卫生局非山卫生局下面很多我们看到了很多的新增案例那么很多的这个卫生命令一个是我本人发的还有就是卫生卫生局下额外增加发
with each individual community we know there are many people in the communities here who live in large multi-generational homes
那么他说非山卫生局下面有很多的社区呢都是这个多家庭的社区比如说所谓的多家庭社区就是公寓养老院还有这个townhouse社区这个就都叫 multi-family 这个社区所以这个他说我们所以在这个非山卫生局又不一样所以它有一些更额外的这个非山卫生局下的这些卫生措施来保护我们的社区安全
Do you plan to make any changes to visiting rules in care homes? And if so, what might they be and when could that happen?
那么现在这个女士问的就是这个长期护理院可能现在这个探亲又不能探了那么你有没有考虑到这个老年人的身心健康了
for many months for myself, for the
那么他
minister,
说
for
我们
all
其
of us
实跟卫生
in the
局
health
局长
sector.
都一直
And
在
yes,
讨
we
论这些
do
问题。
intend to now that
是
we
的，我们
are
是
well
真的想这个做。
along the road of hiring additional staff to support
所以我
long-term
们
care
现在还
homes,
是要
making sure
增加
that
很
those
多人
measures are
手
in
来
place.
支
We
持
have
长期护理
sufficient
院的
stores
卫
of
生工
personal
作。
protective equipment.
这
We
个
will
又
be
是
in
钱
the
呐，
coming
这个
weeks
钱哪里来
making
呢？
some
还不是我们纳税人掏吗？
to support families and people who
那
are
么因为
living
要
in
支
care
持
right
这
now. And
个，
I
因
don't
为
know
主
if
要
you
是
want
支
to speak
持
to
这
that as
些
well.
长期护理院的里边的家庭，所以呢，他说这个 BCCDC 也在积极的跟卫生厅一直在讨论如何增加人手，雇佣新的人来这个支持各个长期护理院的探亲啊、卫生措施啊等等。
strengthen infection control, which is important, to ensure staff is in place, which is important, but also to create the supports necessary to
那么
expand
他说了，这个
visitation.
长期护
It's
理
an
院当然了，
extraordinary
这个
effort.
这
And
个
we've
员
had
工
an
安
extraordinary
全，这个
response
是
in
措
these
施啊，
times
这
for
个是很
people
重
who
要
want
的
to be part
那
of
么
it,
同时呢，
who
我们还
want
要
to be
额外
healthcare
的一
workers. And I
些
see that as a
卫
very
生措施
positive
要
step. So
加强。
we've already made allocated money to care homes
所
for
以
some
现
of
在
that,
还要
and
从卫生
we'll
厅
have a
从省里
detailed
边要拨一
progress
些经
report
费
on all of that
给这些护理院
next week. I know
那么
that
可能下个礼
the
拜会有一
seniors
些
representative
详
done a
细的
survey.
报
Expect at
告
some point in the near future to
进展
receive
会报给
the
大
results
家，
of those
可能
surveys
有
and
些是
those
超
made
过大家的
public.
预
And I
期
know。 both
那
from
么
my
我们也
family's
是收到了
experience
很多的民意调查
and
的数
from
据。
all of the people that I've talked to these many
我们也
months
是
who are
跟很多
struggling
的家庭
with the
进
visitor
行了交
restriction
流
and long-term care,
包
what it
括
means
这
to
些
people.
长期
And
护理院的
we're
禁止
committed to
探
making every
访
effort
或
to
者限制，
try
真
and
的是对
increase
他
the
们造
amount of
成了很
visitation
大
that
的
takes place,
困难
understanding
我们也
that
很理
the
解
risk in long-term care that
但是这
continues to
个
exist.
探亲
BC's
的确是
performance
对
in
长期
long-term
护
care
理院
against other
带来了
jurisdictions
很
has
大的
been very
风
good.
险。
We have to continue to be prudent to keep people safe, and we
所以
will.
我们必须是持续的
Lauren Collins,
保证大家的
Surrey Now
安全，这个是我们所关心的。
Hi. So to be clear, we could see what is essentially a lockdown again in Fraser Health without it being a province-wide order. Can you speak on your thoughts on
菲沙卫生局下有 lockdown 了吗？我没看到 lockdown 嘛可能今天的我没注意到。他说会不会全省都会这么做？
So we have never had a lockdown as we know them from other jurisdictions in British Columbia. And nor
BC
do
省
we
和其他
intend
地方还
to.
不一样，我们
Our
还没有
plan,
做到
which we've
还没有
worked
其
on
他一样，
together
我们还没有
across the
意向
province when
去
we
全
started
省
our
关闭。
restart was it
我
goes
们
in
现
one
在已
way
经
only, and
做了
that we
很多的
need to
努力
learn about
在
how do
已
we
经学
live
到
with this
了
virus
在
and
这个
reduce those
跟病
settings
毒
when we
共
know
舞
transmission is
比如
happening.
说这个
So
餐
we
厅
addressed,
这个很
for
多地
example,
方
when
的
we were seeing
环境设置
transmission
环境的
in
测试
nightclubs,
这个
and
卫生
when
措
we
施
saw the
包括了
transmission,
这
we
个
worked with
夜总会
industry,
等等
put in
如何
additional
看到了这
restrictions,
个
but we were still seeing
减
people getting
缓这些
together and
风险
breaking those rules, and
但
it's
是
very
因为
challenging
那
for
些
people
他
to
们没有
enforce
遵
those
守我
rules
们的
in
命令，
places
所以
like
导致了
banquet
病毒的
halls
传播。
and nightclubs. So
包
we
括了
issued
宴
an
会
order
厅
to
包括
reduce
了
those settings.
这个
We
夜总
had the
会
same
就
idea
是
when it
枝落
happened
网
in
文，卫生措施你们没
in
有
the
完全
summer when
遵
we
守。
started to see
那么他说
parties
从
and
这个夏天开
vacation
始
rentals.
大家
And
也
so
看
this
到了
order
那
that I
个
put
租
in
赁
today
屋
is
又发生
aligned
了
with
很多的
that.
事情
We have now started to see,
所以这些都是没有完全
particularly
按照
since
我们的
Thanksgiving
卫生指
weekend
令
in the
来
last
做。
2 weeks, quite a dramatic
那么包
rise
括了这
in
个过
transmissions
去
that
2
were
礼拜的
related
这
to
么大的
gatherings
新
in
增量
people's homes.
都是这
So we may
个感恩
have
节大
a
家
wedding
的
where
聚
part
会。
of the ceremony is in a church or a
那么现
temple
在
or
开始
a
很多呢
bar,
就是在
and
教会
the
在
rules are
这宗
followed
教
there,
场
but
所
then people go back to
那么
somebody's home
然后呢
and
又带回家
they
去
aren't able to maintain those
那么在
distances
家
and
里边
people
又没有办
inadvertently
法
spread
这
it, and
个
we're seeing
安全
it
距离
being spread
所以
to
我们就
hundreds
看
of
到了
people through several
几百人
events
几
of
百人
that
的这个
nature.
传
Even
染
small
就这么
events,
传
and I
染
mentioned the tragedy
那
of
么我刚才
the
提到了一
woman
个
who
悲剧
died
就算是
this week
10
in
个人
Fraser
的
Health. It
卫
was a
生
small
那
event
个
in a
那个
home
生日
where
party 都
people
会有一个让一个
inadvertently
80岁的老人
brought
死
the
亡
virus in, and the
这个
majority of
是
the
这个
people
是
in
个
that
悲剧
event
这个也是
were
我们菲
infected.
沙
So
局 下面的所以现在是真的是好这个时候了，大家一定要千万注意，千万注意，又是这个流感，现在流感季节又来了，大家除了这个流感生病以外，还有其他的病这个所以我希望大家再深思熟虑，再考虑这个大家期望值不要人家再到我们家里来开 party 了或者是来庆祝这个节日接下来的什么圣诞节等等，包括他说印度人 们的瓦林迪节啊等等都不要这么做了。所以这个我觉得这个对我们这个东南亚华裔韩裔真的是这个话不要说了，我们都遵守的。现在就是那些其他族裔的人不遵守。
So that's the philosophy. That's how we're moving through this pandemic, and it has worked for us. And we are looking to people in British Columbia to pay attention to that now, because we are in a danger zone, and we need to take these actions to make it okay if we're hosting to say no, to not invite those people we're closest to put off the parties and celebrations to a time when it is safe.
只有在安全的情况下，你再考虑这些庆祝的活动。
When it comes to messaging in Fraser Health, specifically Fraser Health, could there be better messaging? Some people have suggested to use the need for messaging in other languages, even in news conferences.
那么他说的是，能不能用其他的语言来把你们的这些卫生的这个信息传给大家特别是在这个菲沙卫生局那么特别是还有这个执法系统能不能加强执法，特别是在菲沙卫生局下。
Group of people who are able to enforce, and that includes police officers and public safety, provincial inspection officers from around the province. So that is one of the reasons why we do have the orders that we have in place. But we also know that we have not had to resort to enforcement for people to understand and follow the advice that we're giving.
如果全部靠这个执法系统来执法的话就简单了，但是很多的情况下是不是靠执法系统来执法人员来加强执法的这个是最难的，所以每个人要有一个这个观念安全的信息这个我们每个人都会受到感染，所以我也希望感谢大家，特别是社区的领袖你们做榜样，做好这个 message 的这个传播也是这个很重要的。
When we're going through a crisis like these, the importance of having our faith community to support us in doing the right thing and keeping people safe and still being able to have that connection to our faith community. So I do want to thank and express my gratitude to the many leaders, and I'm looking to the community leaders as well to help us reinforce the importance right now
能够加强这个让人家意识到重要性，安全的重要性能够让大家这个人员少一点这个就算是人生当中重要的这个重要的时刻是很重要，是要记住，但是安全第一也希望这个宗教方面的社区方面的领袖能够加强这个宣传。所以 Bonnie Henry 也说到了，就是这个记者问的这个执法机关的问题，他说如果任何事情都是执法机关能够解决的话，那就解决了，就容易了。现在很多的情况下的确你靠执法机关是不行的，所以这个就需要这个社区的领袖宗教的领袖能够感谢大家，能够把我们的安全的信息带给大家，带给社区去。
So it is an important way of commemorating those people who went through the many wars on our behalf. And yes, we have been in touch with the Legion here in the BC and the Yukon and provided advice around guidance, and those guidelines are available on the BC CDC website.
那么他也是说到了我们 BC CDC 网站都有各种各样的很多的卫生指引这个指导。
The poppy campaigns will mostly be virtual this year, and I encourage people to purchase their poppy online and to contribute.
那么很多的还有这些虚拟的庆祝活动我也希望大家能够在网上玩一玩虚拟的玩一玩。
Things put in place, so there's provisions for that. Remembrance Day ceremonies will be smaller.
希望请大家紧紧记住，就算你要庆祝人员少一点，今天提出了一个很重要的信息叫 Safe 6， 安全6人中文叫安全6人，我没有好的这个更加好贴切的词，安全6。
Provided guidance that the parties that are the get-togethers that often occur after Remembrance Day ceremonies in Legions and other facilities, that those be postponed this year.
Ashley, do you have a follow-up?
Yeah, I do. Thank you. With weather getting colder, how should community groups and cities navigate addressing homeless populations?
那么这个提到了这些无家可归人员了，的确是他们需要这个，他们没有这个物理距离，没有安全他们也没有完全遵守这个安全的命令。
You know, this was unfortunately an issue that we faced in March when many of the
我们这个3月份的时候也是面临着这个同样的这个很多的很困难，我们也颁布了很多的这个命令。
And with the NGO groups and the community groups to try and address this as best we can. It has been a challenge. As we know, this pandemic has also led to more people in need of housing. There have been strategies that we've been supporting across the province, and it's not a simple answer. Yes, there is work being done to support additional spaces for shelters. There's recently some announcements for money to support
包括更多的庇护所，本来这个庇护所要可以住10个人，现在疫情来了只能住2个人、3个人，是吧？这都是额外的负担，对每个组织慈善机构都是额外的困难和挑战。所以
I don't know, Victoria, if you had any comments on that or.
他也谦虚了，因为他们2个有没有补充的
？Next question is from Mike Hager, Globe and Mail.
现在看下来，好像无家可归的人，他们这个倒反而新冠疫情对他们没有影响，好像马路上还那么多人。
Regarding a traffic incident, showed up on the doorstep without a mask and was about a foot away from a 78-year-old man to discuss the incident. They were kind of shocked, wondering what you make of RCMP in the province not having mandatory masking guidelines for their members. It's up to the discretion of.
那么这位先生问的其实就是戴口罩的必须戴口罩的问题。
We all know that the RCMP has
their
own occupational health and safety.
那么他们有一个安全的卫生的这个措施，他们每个人都有，他们都有卫生指引。
Adhere to, we would expect that they would follow the similar guidance that we are
我们也
providing
期
to
望这个
everybody in British Columbia, which means
RCMP 也有这个正确的跟我们相似的这个那个卫生资，我也希望他们有一个更多的这个一层保护措施包括了这个尽量保持距离那么还有呢就让他们戴口罩能够这样的话能够减缓这个病毒的传播，这个减少风险这样的话是每个人都很安全。
Mike, do you have a follow-up?
Yes, I guess paramedics and the Vancouver Fire Service require their members anytime they're responding to mask up.
那么他说到了温哥华的救护队他们是要求每个人必须时刻戴口罩。
And just writ large, our first responders, are you seeing them in general getting infected on the job at worrying levels outside of long-term care and hospital situations?
Yeah, so when we're talking about paramedics, we're talking and fire response to medical calls.
那么这位先生问的就是这些这个急救人员他们在上班的时候得到病毒的情况如何
the cause of that illness is. So it is standard practice for pre-hospital assessment of people that
那么他说这个是一个他们是穿这个个人防护服的那么都有卫生措施的，因为他们在把每一个就是急救人员在这个送医院之前都有一个简单的诊断。
Infection rate is about a little less than 10%.
低于10%，这些工作人员他们受感染率是低于10%。我知道有一个急救人员，我认识可能是一个救火队员那么他是阳性，我知道最近有一个。
Assisting with the wildfires down in California.
他是到加利福尼亚去帮助扑灭野火的时候获得的在加利福尼亚的。
it's a negligible amount, and I'm not
今
aware of
天
any
今天的确啊，通过答记者问，我们也会知道一些额外的信息，这个也蛮好。所以大家能够听下去不单单每天就是这些数字这些还有一些额外的信息能够听到。
You did mention last week and today about the outbreak in Kelowna.
这个先生问的是学校的Kelowna学校的爆发的情况，听不清楚。
Rob, we lost you. Can you try again? Okay, we'll come back to Rob. We'll move on to Mary Griffin, Tech News.
What? Sorry, Rob is back online. Please go.
今天有问题，因为
Okay, we can hear you now.
他们
Your line is open. Please go.
Okay, talking about the Okanagan Men's Center, their outbreak here. Could you, Dr. Henry, elaborate a bit more about how many people are affected and what is going on?
请他讲一下详细的有多少人受到感染。
My understanding is that there are a number of staff who were
教职员工的数字是
that
受感染的数
there's
字是
no concerns about residents at the moment, and that all of the people who have been in close contact have been
因为都是
identified
亲
and
密接
have
触的
been
这些
and
紧
are
密接
being
触过的
monitored.
都是都在被跟踪监视当中监视不大好。那么 monitor 就是公卫系统人员在 monitor 他们因为就是这个学校爆发了，那么很多教职员工同学都居家隔离了。那么特别那些这个紧密接触的人教师同学都是在公卫系统的监视下。
An outbreak in one of the schools, some cases in other schools, some daycares that have voluntarily shut down. There's one at Okanagan Men's Center. Is there any idea of how this is spreading in this region compared to how house parties in the Lower Mainland? Or is it the same kind of spread here?
Yeah, so one of the things we have learned over the last 10 months around this virus
他说
is
这
that
个
once
过去来
it's
10个
now
月
a
里边，我
community
们对
spread
这个病
virus,
毒
so
的
it's
了
being
解
spread
下来
between people.
这
And
个是
mostly
病
in
毒还是
small
人和人
clusters.
传
It doesn't spread in the same way that we see with influenza, where it sort of goes through a whole population and
它
everybody
不
gets
像
sick
还
at
不大
once
像
and
流
then it
感
sort of
它这个
passes
流
through.
行的
It's really about
特征还不
clusters
像
of
流感
cases, and most people
基本上
don't
一个一个
pass
一
it
个
on to anybody, or at most to one person that they're in a household contact with or a close contact with. But some people we know spread to more, and it's
基
the
本上还是一传
situations
一。那么他说
that we
有时候
create
呢会一个
that
人传
allow
几个
that to
人。
happen. So whether it's we've heard stories
我们也听说了一
both
些
in
事
Ontario
情
but also here about
其他
things
的地
like
方
spin
或者
classes
是
where
我
they're
们
in
这
an
儿也听
enclosed
到的
environment.
有
People
在
are
密
working
闭的
very
环
hard.
境下
Somebody
有
who
一个
doesn't
人
realize they're ill is
他
spreading
已
virus, and
经
other
他
people are
被
breathing it
病
in
毒
and
在到
become
处
sick.
传播
So we
那
are
么其
seeing
他人
those
就传
types
到
of
了
clusters. We're also
那
seeing
么我们也
clusters
看到
where
这些
people
情
have
况零
people
星
over,
的发生
and
的情况
somebody may come from the Lower Mainland and
那么有些
visit
人是在
somebody
这
in
个低落
Kelowna.
平原来有些
This is
是
one of
这
the
个
scenarios
Kelowna
that's
来
happened up
这
there.
他们的传播的
People
形式都
in
差不多
Kelowna unwittingly become exposed, become ill, and by the time that it's recognized, they've had an exposure event in their workplace,
因为
which
他
might
们是
be
生病了他们有症状了然后才慢慢发觉慢慢再追溯到他们哪里暴露了然后呢一点点的跟踪上去接触过我们这个就是他说公卫系统工作人员就是往回溯转肃清这个逆转病毒这个往上走
That's one of the things that we follow very carefully to make sure that we're not seeing widespread transmission that's not associated with some of these events. So it's kind of the neat work that we do in public health, the disease tracing and disease detectives we call people, but trying to make sure we know how it's moving through our populations. And I can say that that is the case from what we know in Kelowna, that it is people who've come in from other places or who've traveled or who've met family members or who've had close contact with somebody who has had the disease and has brought it back, and it's spread in a limited way within their community with the people that they've had close contact with. And that's why the orders that we are putting in place are the same across the province, because we know people go to celebrations of life or go to have weddings or birthdays with family members and friends in other places in the province, and they bring that risk back with them.
那么他也是说到了就是在即使在省内今天在这儿明天在那儿今天是 在参加这个生日会，明天又去走亲访友就是在省内把这个病毒带来带去，所以导致我们全省每一个地方都有风险，没有一个地方说是世外桃源的那么这个。
The union that represents grocery store workers across the province is calling on you to elevate your messaging from the other day, where you said, now the expectation is that people will wear masks indoors in places like grocery stores to a provincial order. I guess my question is, what's your reaction to their request for that? And if you would you consider elevating it to a provincial order? And if not, why not?
Yeah, so we have talked about masks and other
那么也是说到口罩的问题了他说我们也讨论到口罩的问题口罩呢是一个很多的措施里边的一个我们没有这个强调这个口罩的这个重要性我们强调的是所有的措施综合起来不是单单就把口罩拿出来作为一个强制的措施我们现在重点的主要为什么现在是戴口罩重要了因为现在看到了这个现在看到了很多地方在这个省里边很多地方这个传播那么现在要戴口罩是重要了他这个话其实在圆他自己之前说的话之前他说口罩不重要或者什么样后来改口罩是要重要了就是你们在没有在这个保持安全距离情况下戴口罩口罩呢是最后一个保护层那么现在呢开始说现在戴口罩了大家看到了吗他的这个态度在慢慢转变我们华人就喜欢戴口罩说实话
So we have two parts to this in the grocery stores and other retail stores
那么他说了这个零售店其他的这个零售店他们都有卫生措施他们都有有机玻璃所以2层那么顾客也戴口罩那么他们营业员再有一层这个有机玻璃
have access to personal protective equipment are wearing masks where it's appropriate are maintaining their safe distance making sure they have barriers in place
那么还有就是有机玻璃
adhere to the things that we had in place
所以所有的措施都在一起都要在一起
having one-way markers in the grocery store
包括了这个在零售店里边走路的这个指向都是单向这个就是所有的措施有效的联系起来
with people in grocery stores and other retail places
那么包括很多其他我也听到了在一些这个零售店里边
and people who are using those facilities and retail places should be using all of the layers
所有的措施都要用上
wearing a mask
包括戴口罩这个其他的刚才说的这些措施都要结合起来不能只能用一个2个这个是对的他们一开始的好像他不戴口罩不建议戴口罩的一个理由是说人们错误的以为我戴了口罩就万事大吉他主要是怕这个所以他不建议强制戴口罩他说我一强制戴口罩了你们就觉得我只要戴口罩我其他就不管了那么刚才就解释了很多有这个单向走路还有这个有机玻璃还有保持安全距离等等加起来包括戴口罩
So that's not the approach we're taking. We are continuing to take the approach that this is one tool in addition to the other ones that we have that help keep us safe. And I know that most people understand that and appreciate that.
我也感谢大家能够理解这个戴口罩的重要性。我们现在已经看到了很多人在遵守这个遵守这个规定。
In grocery stores when people are doing the other things
那么他说我们也看到了在零售店里边人家在做其他的事情导致了病毒的传播那么比如说没有保持卫生距离
There are very few medical conditions, but they are very real.
那么很少的人由于身体状况不能戴口罩，这个是很少的，基本上还是我们也是相信大家，我们也信任大家所以你们还要其他的措施能够保证保护自己也保护别人安全比如说你们可以基本上网上在买东西你就到店里边去取就可以了 了其他的措施包括支持，那因为这些人不能戴口罩嘛，对吧？那你就网上买了你就取。那么我们也看到了很多人对我们的支持，我们也深受鼓舞
Hi, Dr. Henry. Thanks for this. Just on contact tracing,
那么他是问到的这个接触跟踪的这个工作。
That is it because contact tracing is proving to be more onerous, or we're finding more contacts that have to be traced, and therefore more people have to be involved in this? And also a clarification: you referenced filing a new health order today. Is that a new one, or is that the one from a few days ago?
The health order is the one from Monday, so yeah, no new ones today. In terms of contact tracers, that's additional people. So I do want to say that the contact tracing is work we do in public health all the time, and we have pulled in all of our public health resources, whether it's public health nurses, our medical health officers, environmental health officers from across the province who do this work.
那么公卫系统的很多人都在做这件事情因为公卫系统有很多的工种那么现在很多人都在做这个跟踪接触工作。那么我们 BCCDC 的工作主要是疾病控制主要是这个问题
But that also means there is other important work that they are not doing.
他们也会从各个卫生局下抽调一部分人在重点做这个事情。刚才这个非洲卫生局一开始Victoria Lee 这个医生，他就是在非洲卫生局下带领一支团队在做这个跟踪测试、跟踪接触工作的。
The people who've been doing this work all along, so it is a combination of yes, we need more people because
所以他说我们需要更多的人
，5,000 people now who we need to
现在已经有5000个人在做这件事情了。
Because they've been in contact with somebody with COVID-19.
来支持他说5000个人是指这个现在在这个监视居住下是5000多个人了，所以这个都是要靠我们的公卫工作人员去支持他们的监视他们的。
And may need to go into hospital, may need to have
他们有些人可能要到医院去有些在家里边需要困难需要帮助有些人需要我们给他们一些建议等等，这些都是要我们公卫系统工作人员去给他们支持。
It's a job that
这个的确辛苦，的确辛苦。
因
为住院是没有了，更多人在家里边。那这个问题来了，那个问题来了，的确是需要我们去给他们支持。
We also need to continue with things like our influenza immunization program.
那么包括还有就是这个，他说还有很多人还要分一部分工作去做流感的疫苗的分发这个注射工作。
Was that anticipated? Did this strike me? 5,000 is obviously a lot of people. Was this part of the sort of forecast in terms of where we thought we were headed?
I don't know. There's a good question. I would have liked if we could forecast that we actually our curve went down.
他说你能不能这个预期会下降？他说我也希望这个疫情下降。
The transmission events that have happened.
那么他说这个病毒这个爆发的时候
，a couple of our modeling sessions.
那么我们还有一些这不是模型分析了吗
？When we didn't have a lot of restrictions in place.
一开始的时候我们给大家都做了一些模型如果限制少的话。那么这个对大家来很困难。那么我们现在后来3月份以后呢，我们就开始1期封城、2期封城等等那么后来就是那么我们现在慢慢这个。
We're now in a phase, and we sort of went up and down through the summer.
我们看到了夏天这个疫情下签了有几个礼拜那么才然后马上就要快速的上升了那么这样的话呢，我们要有能力去快速的找到这些人快速的检测。那么现在呢，我们是呼吁大家还是往回走一走让病毒减缓因为这个也是帮助我们公卫系统工作人员帮助他们的工作，因为他们要跟踪接触就是要溯源这个工作很辛苦，所以我 我也希望呼吁大家，他都在这里呼吁大家能够往回走一步，不要再出去，就不要再继续朝着正常的社交活动、正常的生活这个节奏去做，还是要回到6月份、5月份的往回走一走这个那时候的措施。
Last question today is from Joel Ballard, CBC.
Hello, everyone. Thank you for staying for this whole conference. This question is actually for Dr. Lee.
他问 Dr. Lee 了。
There remains some confusion about how people in the Fraser Health region should treat their safe six. You seemed to indicate earlier this week that there were separate rules for people living in the Fraser Health region and that even safe six people should not be invited into homes. It seems you've backed off that today. Can you tell us why?
请他看一看为什么菲沙卫生局的这个政策又变了啊？
Thank you for that question.
请他澄清一下，因为菲沙卫生局又是 Safe Six 以外。
We've said that you should not have even your safe six in your private home.
他说解释一下，就是就算你是家里边 Safe Six 安全6个人，你在家里边开 party。
Because even small gatherings can be risky.
那么我们认为这个就算聚会人少也会有风险。
Whether it's necessary to have people over in your home, and if it is necessary to have that visit with a small number of people. So I think that's the nuance that we wanted to clarify today because we saw some of the information that go out earlier that seemed to misinterpret some of the
可能之前的信息或者是卫生指引给大家建议的话，可能会有一些误会。那么今天再重新澄清。这个大家可以到菲沙卫生局下去看看，菲沙卫生局的卫生指引 Safe Six 的解读不一样，但是今天Dr. Henry 博士就说了，就是 Safe Six 全省 Safe Six。
I guess I could probably answer that in French too. No. No, we're in a.
他因为不会说法语，他说我会说法语说一句 no 不是。
The progression of the pandemic here in BC. We have been at 2 briefings a week, and that has answered most of the questions. We've exhausted many of the questions those days. We also have outreach that we're doing on other days to different groups around the province, and we also have work to do in between times. So I think we're at a good place right now. I was actually looking to move to perhaps 1 day a week.
我也期望每周1次。
We're staying steady where we are
我们
right
现
now,
在
given the
还是维持
situation
2
that we're
次，
in.
因为现在的形势就是这样那么用法语说了。卫生厅厅长是用法语。
Pour ma part, je suis d'accord, bien entendu, avec le Dr. Henry. C'est 2 me paraît le bon nombre actuellement. On va faire le lundi.
有一位网友说蠢猪虽然话比较粗糙一点，我也觉得这个有点恨铁不成钢的意味这个的确这个是自由社会、自由国家，这个政府没有更多的这个强制，只能呼吁大家自觉这个我也代表我没有为政府说好话的这个意愿。但是我们一定要理解国家的体制不一样，这个做法不一样，管理方法不一样。在加拿大更多的不叫管理，因为这个国家人民纳税人是主人，而政府只是协助所以我们不能说他们叫管理，他们不能叫治理中国是管理治理，那么封城一切措施政府怎么说就老百姓怎么配合，那么不一样他们又做了一个看到了吗？姿态戴了3个口罩而那个主持人倒反而没戴那么今天的这个我再给大家总结一下很有意思的我把这个屏幕切掉把声音关掉是这样我把数字再报给大家今天的24小时里边新增案例是234个，那么累计就是14109个，那么记录在案活跃案子是2344例，86个在住院，其中24个在 ICU， 新增1例死亡。这个1例死亡呢特别做了一下，是 一个80多岁的老人在参加了一个小型的家庭生日派对，这个家庭生日派对不超过10个人，他说10个人，所以今天 Bonnie Henry 重点强调了能不参加就不参加然后呢提出全省 Safe 6， 就是安全6也就是你家庭里边你就要办party， 也就6个人。那么有一个记者也问到了菲沙卫生局的额外的指引，因为礼拜一菲沙卫生局可能有一个更加严厉的限制家庭的这个措施，那么问他了，那么这位 Victoria Lee 呢现在也就做了一些解释，也就是 Safe 6， 那么就是 Safe 6就是不要超过6个人除了你家庭的直系成员天天住在一起以外，你不要再超过6个人进到你的家这个是今天的一个给大家额外的信息。第二呢，就是为什么今天把这个新闻简报会放到菲沙卫生局， Bonnie Henry 做了一些解释，说到了因为菲沙卫生局是全省最大的一个卫生局，下辖180万人口但是现在新增最近1-2个礼拜的新增案例绝大多数都在菲沙卫生局下。那么接下来很多的这个宗教节日这个文化的习俗的节日，包括了万圣节，包括了印度的新年灯节吧，德瓦伦丁的灯节，包括了新年，包括了圣诞节，所以有很多很多，希望大家不要举办 party 了，希望大家不要举办 party 了。所以今天重点的信息就是 Safe 6。好了各位观众也有一位网友，谢谢你不辛苦也感谢你们每天在听，每次都在听看我们的直播，谢谢你你说的办不到是绝对是办不到，这个只能是靠自觉了，没办法。因为今天有一个记者也问 Bonnie Henry 能不能做一些这个执法严厉什么Bonnie Henry 说，如果任何事情都是靠执法严厉能够解决的问题的话，那就简单了。那现在事实上很多的事情没有办法去强制或者是执法，没有办法，那怎么办？只能是靠他也是呼吁这个社区的领袖，呼吁宗教的领袖能够把我们的这个安全的信息、安全的概念传播，利用你的影响在社区里边传播这样保护我们的社区。好了，各位观众感谢大家的收看。那么我们下星期一这个礼拜天，应该是这个礼拜6吧，还是礼拜天应该是这个万圣节了，所以希望大家能够度过一个安全的值得纪念的。为什么值得纪念？因为今年的万圣节和往年不一样了，所以安全的值得纪念的这个不一样的万圣节。好，祝大家晚安，下次再会。